Hi, I am Geneva. I am the Quality Improvement Director of the Meadowville Medical Center. Welcome to our training on identifying healthcare wastes in a clinic using the Tim Woods approach. In this training, we will discuss each of the 8 waste categories as defined by Tim Woods and provide at least 4 examples for each type of waste. By the end of this training, you will be better equipped to identify areas of waste in your clinic and take steps to improve efficiency and patient care. Now, I will go over the learning objectives for this training. They are as follows. 1. To identify the 8 categories of waste as described by the Tim Woods approach in clinical settings. And 2. To analyze and recognize specific examples of each type of waste within a clinic and understand the impact of these wastes on efficiency, cost, and patient care. Now, let's look at the acronym Tim Woods. T is for transportation. I is for inventory. M is for motion. W is for weight. O is for overproduction. O is for overprocessing. D is for defects. And S is for skills. Let's begin with transportation waste. Transportation waste involves the unnecessary movement of people, materials, or information between processes. In a healthcare setting, this can lead to wasted time, effort, and resources. Examples of transportation waste include frequently moving medical supplies between storage areas and examination rooms. Let's move on to inventory waste. Inventory waste occurs when there is an excess of materials, information, or work in progress. In a clinic, this can lead to higher storage costs, potential spoilage or obsolescence, and decreased efficiency. Examples of inventory waste in a clinic include overstocking of medical supplies, leading to expired medications or unused equipment. Large quantities of printed forms and paperwork may become outdated. Now, let's move on to motion waste. Motion waste is the unnecessary movement of people or equipment within a process. In a healthcare setting, this can lead to increased fatigue, inefficiency, and potential for injury. Examples of motion waste in a clinic include repeated bending, lifting, or reaching for supplies in poorly organized storage areas. Frequent adjustments to medical equipment due to poor layout or ergonomics. Unnecessary walking or movement between workstations for staff. Inefficient patient room layout, requiring staff to move around obstacles or barriers. Now we come to the waste of waiting. Waiting waste occurs when resources are idle, leading to lost productivity and delays in service delivery. In a clinic, this can lead to dissatisfaction for both patients and staff. Examples of waiting waste in a clinic include long waiting times for patients due to poor appointment scheduling or understaffing, staff waiting for equipment, supplies, or information to become available, delayed test results, leading to longer patient stays and delayed treatment, waiting for approvals, insurance authorizations, or other administrative tasks. The next wastes are overproduction and overprocess. Overproduction waste occurs when more products or services are created than required, leading to excess inventory and potential for waste. In a clinic, this can result in wasted resources and reduced efficiency. Examples of overproduction waste in a clinic include unnecessary testing or imaging for patients, excessive use of disposable supplies, leading to increased waste and cost, overprescribing medications or treatments, producing excessive patient education materials or handouts. Next is overprocessing waste. Overprocessing waste refers to the unnecessary steps, complexity, or effort in a process. In a healthcare setting, this can result in wasted time, resources, and decreased quality of care. Examples of overprocessing waste in a clinic include excessive documentation or paperwork for routine tasks, duplicative or redundant data entry, unnecessary steps in patient registration, billing, or appointment scheduling processes, inefficient use of electronic health record systems, leading to extra work or difficulty retrieving information. Our next waste is defects. Defects waste occurs when products or services do not meet the required quality standards, resulting in rework, returns, or customer dissatisfaction. In a healthcare setting, this can lead to increased costs, potential harm to patients, and damaged reputation. Examples of defects waste in a clinic include misdiagnosis or incorrect treatment due to errors in patient records, communication, or test results. Errors in billing, insurance claims, or patient registration, leading to delays and rework. Inadequate sterilization or maintenance of medical equipment, resulting in potential infection or equipment failure. Ineffective communication between staff, leading to confusion, delays, or errors in patient care. And finally, the last waste is skills. Skills waste occurs when the knowledge, skills, or abilities of employees are underutilized or not effectively managed. In a healthcare setting, this can lead to missed opportunities for improvement, decreased employee satisfaction, and lower overall performance. Examples of skills waste in a clinic include staff performing tasks outside of their expertise or scope of practice, leading to inefficiencies or errors. Failing to provide ongoing training and development opportunities for staff to maintain or enhance their skills. Not utilizing staff input or ideas for process improvements or innovations in patient care. Inadequate staffing levels or poor allocation of staff resources, leading to burnout or decreased productivity. We have gone over each type of waste you may see in healthcare environments and provided examples for each. We used the Timwoods approach in an effort to help you remember them. If you understand each type of waste, you can move to the 8 Waste Jumbo Walk or repeat this training session by clicking the option on your smartwatch.